Aloha, my name is Jessica Ofuia, and this is my media presentation for Anatomy Physiology Lab 2. All right, so here we see patient John Smith. He is a 68-year-old male. Mr. Smith is diagnosed with heart disease. He experienced 2 heart attacks within the past 5 years. He used to be a heavy smoker, and he is a recovering alcoholic. His cardiologist told him that he needs to take aspirin daily to prevent another heart attack that could be fatal. Now let's talk about his first episode. Mr. Smith, he experienced chest and upper body pain, shortness of breath, sweatiness, and nausea. And he also experienced what we call angina pectoris, which literally means strangled chest, which is a severe pain that accompanies myocardial ischemia or a heart attack. He described tightness or a squeezing sensation in his chest and pain in his neck, chin, and down his elbow. So that was his first episode. His second episode wasn't as painful. He didn't experience any pain. However, he experienced a myocardial ischemia, a silent one, which is an ischemic episode without pain. This is particularly dangerous for him or anyone because they have no forewarning of something that's, or alert. His body didn't alert him that something was wrong, and warning him about an impending heart attack. Okay, now let's talk about anatomy and the physiology of the heart. The anatomy, where it's located, the heart is located in the mediastinum, and rests on the diaphragm near the midline. It's relatively small in size, the size of your closed fist. It has 4 chambers, so 2 atria, which are the receiving chambers, and 2 ventricles, which are the pumping chambers. The right atrium forms the right surface of the heart and receives blood from 3 veins: the superior vena cava, inferior vena cava, and the coronary sinus. There is a protective layer called the pericardium, which protects and surrounds the heart, and it is a triple layered sac. So that is the structure that surrounds the heart. The physiology of the heart, so the functions of the heart is a pump. It is the main pump in the human body. It pumps blood through our veins and arteries. It's the primary organ of the circulatory system. Pumps blood through the network of arteries and veins in our cardiovascular system. The heart contributes to homeostasis by pumping blood through these vessels, and which delivers oxygen, and nutrients, and removes waste. So we study the anatomy and physiology side by side to understand how the structures of the body work to maintain homeostasis. Now here we have some anatomical terms, some structures of the heart. We have the right atrium, forms the right surface of the heart, and we have the right ventricle. We have the left ventricle, atrium, left ventricle. The apex is formed at the tip of the left ventricle. The base is the opposite of the apex of its posterior aspect. The superior vena cava is located at the anterior superior mediastinum. let's see, we have the pulmonary trunk, pulmonary arteries, pulmonary veins. The aorta is the main artery of the body. It passes over the heart from the left ventricle and runs down the front of the backbone. Brachiocephalic trunk is an artery of the mediastinum that supplies blood to the right arm and the head and neck. Anterior interventricular arteries, and the great cardiac vein. Now here we have some abnormalities of the heart, which is a part of the clinical connection. So earlier, as we talked about, Mr. Smith suffered a heart attack, so a myocardial ischemia and infarction. A myocardial infarction or heart attack is a result of a complete obstruction of blood flow to in a coronary artery. Now the heart is distal to the obstruction. The heart muscle distal to the obstruction dies and is placed by non-contractile scar tissue, and then the heart loses some of its strength. Depending on the size and location of the dead area, this may disrupt the conduction of the heart and cause sudden death by triggering ventricular fibrillation. And here we have some images with the heart structures that are labeled. Can go through this. This is the anterior. We have images of the heart from different views. And yeah. All right, thank you.